I've got a story about one of the times that dental insurance failed a patient. I had this referral for this lovely 94-year-old lady, and she had a tooth that needed to come out. She was currently wearing a partial denture, and the goal from the referring dentist was to take out the bad tooth, put an implant further back so that we could go ahead and snap her partial denture into that implant so she'd have a lot more stability to maintain her chewing and smiling and all the things that she'd been doing for 94 years. One of the problems is that when we take a tooth out, that tooth is under the dental insurance, and if we wanted to replace that missing tooth in particular, we would be able to do it. Insurance would have covered that. However, the dentist wanted the tooth further back, which makes more sense from an engineering standpoint because then it would have more of a tripod and that partial denture would be a lot more stable. But guess what? She'd already been missing that tooth, and the insurance company had a missing tooth clause. Think of it like in medical insurance when you've got a pre-existing condition. In this case, the pre-existing condition is the missing tooth. And so we wanted to put the implant further back, and we did put the implant further back. But guess what? Insurance did not cover it, even though they were willing to cover a big chunk of the cost of the dental implant itself. Thankfully, that patient went ahead with the treatment. I ended up seeing her 2 or 3 years later for another issue, and she was still doing great with what we had decided for her. But that was an example of when we decided to go outside of what the insurance would cover to get the best result possible for her.